Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Ogun State government solicits help of community, traditional and religious leaders to vaccinate 2 million people ahead of the Yuletide. Traders in Jigawa State lament effects of coronavirus disease on their businesses. And the World Health Organization says COVID-19 related deaths have increased as more than 50,000 are recorded weekly worldwide and actual numbers are higher. According to the Nigeria Center for Disease Control, NCDC, 2 more people have died from the coronavirus pandemic. Data from the center shows that an additional 87 new infections were confirmed across 7 states and the Federal Capital Territory. The fresh cases have raised the total number of confirmed infections in the country. Here's more on the virus update.
87 additional persons in Nigeria have been recorded as positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 7 states and the FCT and indicate a drop from the figures reported 24 hours earlier. Zamfara State recorded 29 cases, while the FCT had 25. Rivers State reported 11 cases, Kano reported 8, Bauchi 5, Gombe 4. Lagos and Jigawa reported 3 and 2 cases. No cases were reported in Delta, Edo, Sokoto and Taraba. The total caseload in Nigeria has risen to 212,446. 37 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 204,047. There were 2 additional deaths from COVID-19 complications reported in the last 24 hours, raising the total number to 2,902. Currently, there are more than 5,000 active cases in Nigeria, while over 3.3 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that more than 5.7 million Nigerians have received the first shot of a COVID-19 vaccine, while over 3.1 million persons have been fully vaccinated. Globally, more than 7.1 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 219,000 deaths recorded across countries on the continent. More than 248 million people all over the world have contracted COVID-19, while deaths are over 5 million.
And the government in Ogun State is calling on community leaders, traditional rulers and religious leaders to support the efforts of government towards mass vaccination of residents of the state and to ensure the efforts to mitigate the spread of the pandemic. The State Commissioner for Health, Dr. Tomi Koka, made the call during a meeting with representatives of community leaders from the 20 local government areas of the state to map out modalities for the success of the program. She believes that this is necessary to mitigate community spread of the virus in view of the forthcoming Yuletide season.
Our aim is to vaccinate 2 million people before Christmas. If you ask me why, it is important. We've had 3 waves of COVID-19 in Nigeria. And even the first wave came after Christmas, when the people from England and America and Italy came to Nigeria. The people in diaspora came. 6 weeks after they came was when the outbreak started. The second wave, we noticed, came around sort of June, after the Easter holidays. The third wave was January this year, when they came for Christmas again. There was an outbreak. That was why they don't let anybody in without a swab now. Nobody comes in. But we know that our children will be coming, our brothers, our sisters, mothers, they like to come home for Christmas. Christmas is coming. And if we don't ensure that we vaccinate 40% of our population, God forbid that we start the new year again running helter-skelter. At this point in time, the isolation center, there's no one patient because people are getting vaccinated and there's no foreigner coming. Well, they're coming, but we're catching them. So it is important that we come out en masse and get vaccinated so that 2022 would be a year of real economic development in Ogun State.
According to the United Nations Development Programme, the pandemic's impact has touched almost every aspect of modern life, upending public health systems, the global economy, travel, supply chains and community, and also how we work. The Secretary General, Nigerian Association of Small-Scale Industrialists in Jigawa State, Comrade Danlami Haladu, believes that developing countries have suffered disproportionately due to the socio-economic fallout from the pandemic. He says small and medium enterprises are the worst affected. Our correspondent Sadiq Ilyasu has more.
The effect of COVID-19 pandemic has cut across every aspect of human activity. In Jigawa State, business ventures are yet to be on their feet after safety measures employed by government last year caused losses.
Before COVID-19, business was better, but since the outbreak and the government-imposed lockdown, we've been having problems, despite the lockdown being lifted.
Many people were able to access COVID-19 relief funds, but in my own case, I have applied for NISA loan to help my business, but I didn't get it.
The Secretary General Nigerian Association of Small-Scale Industrialists in Jigawa says government must intervene for business to bounce back.
2 years back, during COVID-19 era, a lot of people suffered, business cripples, but with the quick intervention of government through its agencies, people are now coming back to their normal businesses. Before, during the era, a lot of people lost some of their assets and other things.
Although cases of COVID-19 are dropping in the country, the effect on the people remains. The hope is that authorities do the needful to support the economy. Sadiq Ilyasu, Channels Television News.
And outside Nigeria, the number of new cases in Germany has beaten a record set in December 2020. Health officials have met to discuss the possibility of fresh restrictions for the unvaccinated. Germany registered a record number of COVID-19 cases on Thursday, according to the Robert Koch Institute. The news came a day after Health Minister Jens Spahn declared that Germany was living in a pandemic of the unvaccinated and that the fourth wave of the virus was in full force across the country. For more developments this week in terms of the situation, joining us is Deutsche Welle correspondent Arthur Sullivan. He joins us from Berlin. Hello, Arthur. Why are infections so high again?
Well, infections have indeed soared. If you look at the figures, they've reached a new high just today, 37,000 new infections, which is the highest at any stage since the pandemic began. And also the incidence rate, that's the number of new infections per 100,000 of population over the course of a week. That's also now hit its highest level, even since the peak days of last spring and winter. So the reason for that is twofold, really. Over the course of the summer, restrictions have been loosened significantly across Germany. You can see now everywhere bars, restaurants, theatres, stadiums are open largely as they were before, and people can go there and congregate indoors. Obviously, though, as we know, the virus spreads indoors, and with the weather changing significantly with cooler temperatures, it means that more people are doing that and the virus has been given a chance to spread. That's an obvious thing for starters. However, another significant factor is the amount of unvaccinated people in Germany. So around 1/3 of Germans are not vaccinated, and the health minister has said that this is largely a wave. The fourth wave is a pandemic of the unvaccinated. So when you have so many millions of people who are not vaccinated, it obviously makes those people more vulnerable to picking up the infection and also, crucially, developing serious forms of the infection, which leads them to go into hospital more likely and ICU units.
But is there a push to increase restrictions for the unvaccinated, and how is it likely to work?
The big question at the moment. So over the last few days, since the 1st of November, in fact, there have been a few new rules that have come in for unvaccinated people. One of them is that if you're unvaccinated and you're unable to attend work due to quarantine requirements, or if you've returned, for example, from a hotspot, then your employer will no longer pay for your time off in that case. So that's obviously a big incentive for someone to get a vaccination. Also, there are increasing costs for getting a test if you're unvaccinated. It was free until recently. Now it will cost you up to €40 to be tested if you're unvaccinated. Another big question is whether events should cover vaccinated people, recovered people, and also just people who are simply there with a test. There's a push now to make more and more events so-called 2G events. That would mean that only vaccinated or recovered people can enter. And if you only have a negative test result, that may no longer be enough. So that's one of the big questions that's going to come, to increase restrictions for unvaccinated people. And that is currently being debated by the German health minister and the local health ministers.
But how is the situation in the rest of Europe? And do you think, are there more lockdowns on the agenda?
Well, unfortunately, the situation in the rest of Europe is not much better than it is in Germany. If you look at the figures in the various countries, the incidence rate and the number of new infections is climbing and has been climbing over the last month very, very steadily. So just yesterday, the WHO said that Europe had once again become the epicenter of the pandemic, and emphasizing again the situation with unvaccinated people. However, whether lockdowns are on the agenda or not, that is unlikely, I would say. Certainly in Germany, there would be considerable public opposition to more lockdowns. In August, the health minister promised that for vaccinated people, there would be no more lockdowns and that restrictions would largely focus on unvaccinated people. However, we obviously don't know with this virus. It has surprised us so many times since it began that we can't really say for certain how bad things will get with the figures. And if the numbers climbed, particularly in hospitals, and the number of new cases and deaths, if they climbed to worrying levels once again, we couldn't rule out more lockdowns. But at the moment, the politicians are saying no more lockdowns, particularly for vaccinated people.
Arthur Sullivan, Deutsche Welle correspondent, joining us from Berlin. Many thanks. We're going to break now. When we return, we have more on the global situation of the pandemic. Please stay with us. Welcome back to the program. U.S. drug company Pfizer says, according to its clinical trial results, its experimental pill to treat COVID-19 cuts the risk of hospitalization or death by 89% in vulnerable adults. The drug Paxlovid is intended for use soon after symptoms develop in people at high risk of severe disease. It comes a day after the UK medicines regulator approved a similar treatment from Merck. Meanwhile, the World Health Organization says recently new confirmed cases and deaths caused by COVID have risen again, as more than 50,000 deaths were reported weekly worldwide at present.
First case of COVID-19 were reported, and almost a year since the
Mr. Tedros Ghebreyesus says that so far, the World Health Organization has counted more than 5 million deaths from the pandemic worldwide, and that the actual number is even higher. In order to better fight off the pandemic, the Global Health Agency has approved another COVID-19 vaccine for emergency use, known as Covaxin.
We added another new tool with the emergency use listing of Covaxin, the AIDS vaccine to receive WHO validation for safety, efficacy, and quality. Emergency use listing contributes to vaccine equity by enabling countries to expedite their own regulatory approval to import and roll out vaccines.
North Korea continued to intensify anti-COVID efforts at schools while encouraging students to undertake extracurricular activities. A video provided by the country's official news agency shows students wearing face masks, sanitizing their hands and undergoing body temperature checks upon arriving at the Kumsung Secondary School. Employees are wearing protective suits and they were seen disinfecting classrooms and corridors. The video cannot be independently verified. The Chinese mainland on Thursday reported 68 new locally transmitted COVID-19 cases, according to the National Health Commission in its daily report today. The Commission also reported 10 new imported cases on the day, of which 3 each were reported in Shanghai and Guangxi, Zhuang Autonomous Region, one each in Tianjin Municipality, Liaoning, Guangdong, and Yunnan. One of the new imported cases in Jiangxi Zhuang Autonomous Region was recategorized as an active case from an asymptomatic case, according to the Commission. Finally, children aged 5 to 11 have begun receiving their first shot of the COVID vaccine in New York. 7-year-old Nora Gassett and 10-year-old Maya Schneider were amongst those to be inoculated.
It's basically like a flu shot, but it didn't even take a minute. It basically just took a couple seconds and then it was over.
The 10-microgram shot of the Pfizer-BioNTech vaccine authorized for school-age kids, a third of the strength given to adolescents and adults, offers protection from the Delta variant of the virus that has led to thousands of pediatric hospitalizations.
And back in Nigeria, participants at a one-day gender-based conference in Kaduna State are stressing the need for empowerment of more women and education of young girls in order to overcome the negative impact of the COVID-19 pandemic. They say the fight against the pandemic will be better managed if more women are financially empowered and educated.
It's a gathering that has brought together members of the academia, government officials and other stakeholders with interests in gender equality. Conversations focus on COVID-19 and its impact on gender, as well as the way forward for women.
This gendered social relationship had been, for the most part, negative on the women because the social economic cost of pandemic was more on the informal sector where women play the leading role.
Apart from affecting livelihoods and other socio-economic activities, gender-related issues were also impacted by the pandemic. Cases of rape, domestic violence, sexual abuse, child molestation and other social vices were on the rise during the lockdown. For the wife of the president, who is represented by Mrs. Rukayat Burni, significant progress will be made in the country if more women are empowered and their standards of living improved.
Look into issues of gender inclusion and how to domesticate the gender policy, especially as it relates to access to girls in terms of admission, enrollment into sciences, engineering, and other related matters.
The Gender Policy Unit of the Ahmadu Bello University Zaria has now established a gender harassment policy to address issues of gender violence within the institution.
You have to look at both gender. And you see, if you don't look at one part of the gender, the development will be skewed. And what we did, or what we are doing in ABU, is to make sure that we get statistics.
Going forward, participants are unanimous in their agreement that there's a dire need for gender equality and inclusion for women to mitigate the impact of the pandemic on their lives.
And One Health policies are needed for a sustained future of One Health and future engagements. Experts believe that mapping the One Health landscape in Africa is desirable for effective monitoring and evaluation, also measurable outcomes. The One Health approach is the collaborative efforts of multiple disciplines working locally, nationally and globally to attain optimal health for people, animals, and the environment. Joining us for more on this is Professor Christian Happy, a professor of molecular biology and genomics in the Department of Biological Sciences at the Redeemers University, and he joins us via telephone at this time. Thank you for joining us, Professor.
Thank you. Nice to have me again.
Great, thanks. First of all, I'd like to get your thoughts if you think that there is any danger concerning the spread of COVID-19 as we approach the Yuletide season.
Yeah, there is definitely a danger for the spread because it is clear that people that are not vaccinated, as shown everywhere in the world, are the ones actually, responsible for fueling the transmission all over the world. So, and as such, because we're getting into the festive season, people will be traveling, and as many people as are not vaccinated, then there's a really high probability that you may end up having a fourth wave if care is not taken. So I think it's very important that people, adhere to the public health, prescription by ensuring that they can all get vaccinated before the holidays.
The African Development Bank President, Dr. Akim Adesina, said that vaccines and debt relief will be key to Africa's recovery from COVID-19. But looking at the predictions, the current case numbers, would you say that Africa has succeeded somewhat in fighting the virus?
Well, I think Africa, despite the lack of vaccine, have succeeded, in a way, in fighting the virus. Remember that before, when this pandemic started, there was prediction that 6 months in the pandemic, we will have over 3 million African dead, and we will have over 70 million, or 70 million of people infected. But that has not been the case. We've seen also, in the past few weeks, a decreasing number of infections and then also the number of deaths in Africa. I think the report by WHO is saying that we have a reduction of 9% of cases in Africa, and also this is translating in the reduction in number of deaths. And I do think that despite the fact that we are not largely vaccinated in Africa, we have not really had a high number, as predicted. And we should try as much as possible, to avoid, to get into a fourth wave that could be very deleterious for the continent. And as such, I think it's very important for people, to get vaccinated, and then to also continue to stick to public health, measures, social distancing, and then wearing of masks. And then those that are vaccinated shouldn't just lower their guard. I think it's very important that we should continue, even vaccinated or unvaccinated, to respect, the safety measures, as given by the Nigeria Center for Disease Control and the Ministry of Health.
Indeed. And just days ago, Africa celebrated the Global One Health Day. Are we advancing the initiative across the continent?
Yeah, I do think that going forward, disease surveillance shouldn't just be, disease surveillance should be using the One Health approach. So and that is really what is being promoted all across the globe right now. Surveillance, disease surveillance without taking into account the environment and without taking into account animal health really will not lead us anywhere. Remember that most of 70%, of pathogens that we have zoonotic potential actually come from animals. And as such, it's very important that we embrace a One Health approach towards disease surveillance in order to prevent, the next pandemic or the next outbreak.
But are we applying that in Nigeria, seeing the impact of the pandemic in its second year?
Well, if it is not applied, I think going forward, that's the approach that we should apply. Remember that this is not something that is integrated already into the surveillance system or the disease surveillance system. It is something that is relatively new, in many settings, even though the One Health approach to, for public health is in existence, for many years. But I think, although people talking about One Health, that is, it really has not been integrated into the disease surveillance model of most countries. And really, with the COVID pandemic, I think it offers an opportunity to actually, integrate, the One Health approach as a way to move forward when it comes to, disease surveillance in Africa.
We appreciate your time. Thank you so much, Professor Christian Happy, for taking time out and of course, get to your destination safely. Thank you so much for joining us on the program.
Thank you.
All right, adherence to all non-pharmaceutical preventive measures of COVID-19 will help curb the spread of the pandemic. Continue to take responsibility. You can take a look at our website. It's channeltv.com for the latest updates. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.